chemical peels. That sounds terrifying. But today in this video, we're gonna be talking about chemical peels. What are chemical peels? What goes into a chemical peel? What are some options for home chemical peels? And then what type of chemical peels we can actually do in the office.
And the question is like, why would you want to peel off your face? This is an age-old question, but with good answers. We'll tell you about what a chemical peel is, why you would want to undergo all of that, or would you? And then again, what you can do at home and in the office. So all things chemical peels, here we go. First off, we want to thank L'Oreal Paris for sponsoring this video. We are going to highlight one product from them. This is the L'Oreal Paris Bright Reveal Dark Spot Exfoliant Peel, AKA the snake peel. And actually what I'm gonna do, just because I can, I'm going to put this on. You're supposed to leave this on for 15 minutes and rinse, and we will try to complete this video in that time. I've actually used this quite a few times recently. I really enjoy the product. So I'm gonna put it on now. We'll get some close-ups later. It's like a vivid green.
Now there's something about colorful products that really get me excited, and we've talked about this before, but you've seen a red peel maybe in the past, maybe you've seen a purple one, and now we have this beautiful green. Green is my favorite color, it turns out. So we'll have Dr. Maxfield leave this on throughout the video, make sure he survives through the video while we talk about all things chemical peels.
Right, so timer is set to make sure I do a good job with doing this appropriately.
So what is a chemical peel? So chemical peels were one of the first cosmetic procedures that were performed, and they predate lasers. Pretty much any type of rejuvenation where you would really be trying to reverse a lot of the sun damage that we would see with aging was achieved through chemical peels. And there were dermatologists who like literally specialized in just chemical peels. Like that was their thing that they did. And now it's usually a combination of these two things where you'll see some people who will go more towards chemical peels for certain things, and then they'll go towards lasers for other things. So to understand chemical peels, we have to first talk about the molecules that are involved in this process, and then try to understand what they do and then what benefit they'll have on your skin. So what type of ingredients fall into this chemical peel category?
So classically, and the ones you'll be more familiar with are what we've talked about before, is the beta hydroxy acid, salicylic acid, your alpha hydroxy acids, classically your mandelic, lactic, glycolic acid, and then you have your TCA peel, and then we actually have the phenol peel, and a lot of different combinations and different versions in between.
So you could have glycolic with mandelic with maybe even some retinoid in there, right? So you kind of mix these together and then achieve different effects with this. So the way that these actually work, and some people, they call it chemical peel, some people call it chemo exfoliation. Basically the way that it works is you have a chemical structure like glycolic acid, which is your prototypical exfoliating acid because it's the smallest alpha hydroxy acid that's available. It basically makes your skin cells separate from each other, to make it simple. Then they penetrate into the skin, they send signals into the dermis, and it stimulates collagen production. And depending on the depth of the chemical peel, it can achieve different things. In the office, you have superficial, you have medium depth, and then you have deep depth chemical peels. And the reason why I bring this up in this part of the video, even though we're gonna be talking about those procedures at the end of the video, is because the ones that you have available over the counter would fall into just above superficial even, right? So you could call them supra superficial, the ones that you find available over the counter, because they go slightly less deep than even the superficial chemical peels that you would get in the office.
So that's what they do, and the benefits that you'll see clinically from this, it depends on the depth. So superficially, you'll see improvement in things like dark spots, tone, texture, and some of that is directly related to the exfoliation, if you will, or the removal of cornea site adhesion from the exfoliation itself. The other arm of it is some of these molecules actually send signaling cell growth, like a glycolic acid peel or some of these other ones, although they don't go deep enough, they're not aggressive enough to directly mechanically peel away to the depth of the base of the wrinkle. They actually send signaling molecules so we get increased collagen growth, fibroblast activity, and all of the things that actually create the stimulus for new bounding healthy skin.
So it basically sends a signal, the same signal that your body would have as if it was injured. And in any type of injury mechanism that occurs to the skin, it boosts all those wound healing mechanisms which stimulate collagen production. That's why these chemical peels end up having profound anti-aging benefits, even if they're superficial, but even more so if they're deep, because they truly are causing wounds to the deeper layers of the skin. And you want to make sure that you don't go too deep, because then you actually eliminate the body's ability to create those wound healing mechanisms. So it's a very tricky art, but once you get it right, it can really have profound anti-aging, anti-wrinkle, anti-dark spot benefits on the skin. Let's talk about safety, because Safety is critical, especially we're going to be talking about doing things like this at home, and then the things that you need to prepare for when you're going into the office. So when you're thinking about exfoliating acids, what are the main concerns you need to think about?
The main problem with these is irritation. Like irritation because of how these ingredients work is your limiting factor and your first potential problem. So know your skin, don't be too aggressive, don't use it too frequently. Like we saw with some other peeling solutions early on, people were just going wild. They were using a ton on their face, they were using it every day, they were like derma rolling it into their skin. It was just chaos, and inevitably you're going to have bad outcomes that way. So don't use something too aggressive, read the instructions. Please read the instructions and follow the instructions.
And when you're doing these at home, like you said, read the instructions, because certain chemical peels at home or certain exfoliating acids at home are meant to be left on all night, and they're safe to be left on all night. And then other ones are meant to be left on for shorter periods of time. Be very careful about how long you leave something on. And certain ingredients are self-neutralizing, meaning that they deactivate themselves over time. And so even if you left it on, it would cause no harm. And then other ones need to be neutralized by you, and so you need to be careful how long you leave those on, because otherwise they stay active as long as they're in contact with your skin. So follow the instructions when you're buying anything at home. Afterwards, it's very critical what you do next as well, because during the healing process, your skin is going to be extra receptive to sun damage, because you've basically removed one of the protective layers of the skin. And in that process, you can get more likely to get sunburned, you can be more likely to get hyperpigmentation. So wearing sunscreen diligently, protecting yourself against the sun. I always criticize people for wearing those sun visors and like being extra protective, because I think a lot of times it's overkill. But in this scenario, after you get a chemical peel, especially a really deep chemical peel, it's really important to protect your skin during the healing process. So definitely wear sunscreen afterwards. You also may want to put a hold on your retinoid for a short period of time while your skin is repairing itself. So let's talk about how to prepare your skin for an at-home chemical peel, just like the one that you're using right now.
So when it comes to using an at-home exfoliator or chemical peel in general, when you're prepping the skin, the first thing you're going to do is just wash the face, right? But it's actually more important than that. In the office, we call it degreasing. We use an alcohol pad or other ingredients to actually remove as much oil, make sure you're removing all your makeup, because you want a very even layer of application. And not only does that decrease the risk of you getting like hot spots, but it also makes the peel more effective. So it's both for safety and efficacious reasons. And then the next thing, after you've washed your face, is protect the areas that are sensitive. So you can actually apply a thin layer of Vaseline to areas around the eyes, around the mouth, on the lips themselves. And this will help keep the exfoliating ingredient, the irritating ingredient, only where you want it, and not on areas you should be avoiding.
And then you take your high strength chemical exfoliant. You don't want a microneedle before, you don't want a microneedle after. On intact skin, you apply the product, thin layer, and then you leave it on for as long as the packaging says to leave it on for. Some packaging will say leave it on for 5 minutes, some will say 10, some will say 15, some will say you can leave it on all night. You really want to pay attention to what the packaging is saying, because that's how they tested it when they did their safety studies, that's how they tested it when they did their results studies, that's how they used it. So follow the instructions on how long you want to leave it on for. If it says to wash it off, use some lukewarm water, maybe use a mild cleanser, and then simply moisturize afterwards. Now, some people will do the rest of the routine afterwards. I would say just focus on your hydrators, focus on your things that are calming and soothing the skin, and moisturizing. And that's pretty much all you would want to do in your night routine. And then of course, critically important, chemical exfoliation will make you more sensitive to sunburns. You need to be wearing sunscreen in the morning if you're going to be exfoliating like this at night.
So that's how you prep your skin, that's how you protect your skin afterwards. In general, that's how you're going to approach exfoliation. So now we'll get back to highlighting the product we were going to talk about at the beginning. This is the L'Oreal Paris Bright and Reveal Dark Spot Exfoliant Peel. This is the snake peel. And the thing that's nice about this product is that it is a combination of 25% multi-acid exfoliating peel with alpha hydroxy acids, which we talked about, glycolic, lactic, mandelic, beta hydroxy acid, and then a very gentle form of acids, polyhydroxy acids. And so you're going to use this every other day, apply enough to get an even layer. I actually already applied this. And then you're going to apply it on areas of the skin that you want, sparing the sensitive areas of the skin.
You have to squeeze a little drop right here at the tip. I love doing like a light chemical peel on my nose just for sebaceous filaments. Really kind of improve the texture there. This is something you can do more often, honestly. That's how you're gonna get that smooth nose.
And then for this one, again, you leave it on for 15 minutes, and then you are gonna rinse your skin thoroughly, and that's it. This is like a very unique product because they showed me a lot on the back end. Because when it comes to exfoliation, so much matters, like pH, concentration, all of that plays into the effectiveness of a product. And so they kind of showed me how they really balanced the pH with the free acid value, with all of it to make sure it's effective, but also to try to make sure it's as gentle as possible. And then the clinical endpoints, they showed this helps tremendously with dark spots, texture, and then specifically post-acne marks. A lot of great benefits from using this consistently and as directed.
Now again, this is meant to be left on for 15 minutes.
It's timely.
And now his 15 minutes is up, so he's got to wash his face. Now this is meant to be left on for 15 minutes, and it has all those heavy-hitting exfoliating acids that he mentioned. It also has niacinamide, which is an ingredient that we love and does so much for the skin. This product has denatured alcohol, which makes a lot of sense in this formula. We always talk about being deliberate, but when you're talking about using an exfoliant in the office, when we degrease the skin, we either use acetone or we use denatured alcohol to essentially remove any oils from the skin so that you can get an even application of the chemical peel. So it actually makes a lot of sense in this formula. Now, if you have sensitive skin, this product also has fragrance. Now, it's only going to be on your skin for 15 minutes, but you have to weigh the risks and benefit. If you're allergic to fragrance, you may want to avoid this.
Right, so yeah, with fragrance, just know your skin. Always caveat that if you're allergic to fragrance, avoid fragrance, and this is no exception. Now, I will say, this is my favorite part of the peel. So like I said, I've used this before. It's very gentle. So I put it on specifically for this purpose. Like you all saw the vitamin C video. You saw how easily my face gets red and flushed. And you also saw how it sat for 15 minutes, but cut up over whatever length it is when we edit this video. I find this peel extremely gentle. There's a very nice cooling sensation afterwards. Like I love how my skin feels like for the next 2 hours after I use this peel. It's wild. I've had like such dramatically different experiences with these multi-layered exfoliation peels. This one does great for me. And because of all the thought and science I know they put into creating a gentle formulation with a lot of efficacy, the whole point of this is that it does great results while still being gentle. And the phrase that I came up with, gentle enough for the beginner, but strong enough for the experienced exfoliator. And I still think that's true with this peel especially.
Now, this is one of the highest strength exfoliants that you're gonna get available over the counter anywhere, pretty much. So you're really gonna see the efficacy with this. This is not one of those products where you see, a few percentages of glycolic acid, 2% of salicylic acid. This is a really heavy hitting, and this is really as close to an in-office chemical peel as you're gonna get at home.
I'll show you my face close up. As you can see, minimal redness, multiple acids for multi-layered exfoliation, great results.
Next, let's talk about some of the options that are available in the office. Like I mentioned, there are 3 different layers of chemical peels, and the way we use them has gotten more and more interesting. So it's sort of interesting. We have superficial, we have medium depth, and then we have a deep depth chemical peel. This grading system is based on how deep in the skin that they go. So superficial indicates that it doesn't go any lower than the epidermis, which is that top layer of the skin. And then your medium depth chemical peels go to the papillary dermis, which is the upper level of the dermis. Now your deep depth chemical peels go to the reticular dermis. And if they go below the reticular dermis, you will have severe burns and being unable to heal yourself. That's why when you get into deep depth category, which is your phenol peel, which is the video that we showed in the beginning of this video, this is where you can get into a lot of trouble, not only because there can be cardiovascular risks with that peel, but also because you can actually scar yourself severely if you leave it on for too long, if it's not done in the right hand. So if you're gonna get something like this done, make sure you're going to somebody who knows what they're doing. Now, when I talk about chemical peels, I think this is one of the categories. This and IPL is probably the 2 categories where I see the most injuries happen in an office where people are not trained on how to use this. That's either using too high of concentrations, not neutralizing the product, or leaving it on for too long. So just be cautious with that there. So first, let's start with the superficial depth peel.
So superficially, this is going to be most helpful for something like acne. Light texture. And salicylic acid is your prototypical in-office peel. You're going to see this being able to be done for pretty much all skin tones, which is nice. And then you're also going to be seeing this done, especially in the setting of acne. This is really going to be the easiest, most superficial peel you can get. It's pretty gentle. It self-neutralizes. There's not much sun sensitivity, if at all. Very easy way to introduce yourself into the in-office peel setting.
So this is something that you simply go into the office, dermatologist will take some salicylic acid, kind of rub it on the face and send you out. And we use this very often for people with acne. Now, some people will just use your topical treatments and your oral medications, but it's a really good adjunct to people who have acne. It really does help with people. And a lot of patients actually just come in just for this. It really is something that's quite effective. Also in this superficial category is your lower concentrations of glycolic acid, so 20 to 30%. 30 to 40% glycolic acid. You also have your light TCA peels, trichloroacetic acid peels. Mandelic acid falls into this category. And so depending on the concentration, these are usually going to be your superficial peels. You may or may not get peeling with these, meaning that when we talk about a chemical peel where you actually feel your skin peeling off, with superficial peels, sometimes not. It doesn't mean that it's not working if you don't get that actual peeling effect, but it's usually those medium depth peels where you're truly going to get the sloughing of the skin.
So if the superficial peels go to the bottom of the top part of the skin, the medium depth peel will go to the top of the bottom part of the skin, and the deep peels go to the middle part of the deep part of the skin. But the medium depth peels, TCA is like a perfect introduction, because depending on the concentration and also the amount of passes, all of the things we talked about, TCA is a very flexible ingredient. It can be used for superficial peels, it can actually be used for deep peels, and it's actually the concentration that actually correlates to the speed of absorption. But depending on the technique used, that actually determines the depth of the peel with TCA. So it's like a very unique ingredient. But when you get to medium depth peels, those can actually be helpful for, of course, more texture, deeper lines, more color tone. Also can be helpful for light seborrheic keratoses, like these little stuck-on growths on the skin. So that's a nice way to improve those, where basically to this point, almost nothing topically does.
With a medium depth, you're gonna see a real good improvement in texture. Even some of your deeper acne scars will be improved with this. And TCA can be used as TCA cross procedure, where they use a much higher concentration of TCA, and we actually dot it into your specific deeper acne scars. So if you have atrophic acne scars, ice pick acne scars, we'll dot trichloroacetic acid into that, and it basically creates a scarring, frosting within that really helps to stimulate collagen production and even out your skins. I've used chemical peels in this category in many different ways, and the effects from this type of chemical peel are actually quite profound. If they don't take care of their skin well afterwards, they're not wearing sunscreen afterwards, this is where people get a lot of hyperpigmentation. This is where people get results where they're very unhappy with them if they don't take care of their skin in this category well.
Right, it's very, very important to protect your skin afterwards. The recovery on this, although not like prolonged, it's still relatively quick, like a week. It's paramount that you protect your skin, not only the skin barrier, but also from the sun. Then the last category here is the deep peel, and this one is what we saw in the video. The phenol peel is the prototypical deep peel, and the results are wild. They're dramatic. They're exceptional, but again, like we talked about a moment ago, the safety is a real concern, both directly from the depth of the peel itself, plus there's cardiovascular risks. There's all sorts of things that you really, really, really have to be in the hands of someone who's experienced and has gone above and beyond in their training to get good at this.
When you're going down to the reticular dermis, you're talking about getting to the area where your skin may not be able to heal itself anymore if you go too deep. So this is extremely important. This is where like burns go down to the level of. And so you have to be very careful that you know what you're doing. But because it goes this deep, the results like you see in this video and many other videos that you'll see on the internet are extremely profound. I'm talking about erasing 10 to 15 years of sun damage in a single treatment. And for people with acne scars, again, extremely profound results, because with acne scars, especially those deep atrophic acne scars, that tethering that is occurring in those deeper layers of the skin. And so in order to improve them, the superficial peels aren't really gonna have that type of benefit. So this is where you're gonna see really those profound results. You're also gonna have some of these profound side effects. And then many of you have heard of other like quote unquote brand name chemical peels, like the VI peel, like the Cosmelin peel. And these are combinations of different acids that we've talked about in this video. Some are targeted more towards dark spots, some are targeted more towards the anti-aging benefits. But again, these concepts that I described here, superficial, medium, and deep, all apply across all chemical peels.
That's the breadth of peels. The at-home exfoliants and the at-home peels definitely have their place. The in-office ones, definitely a very personalized decision with you. And for at-home, like we talked about, the L'Oreal Paris option is just like a great option for both effective results out of a gentle formulation. So thank you to L'Oreal for sponsoring this video. Hopefully you have a good idea as to where you can go from here with your peels.
And when it comes to exfoliation and these chemical peels, remember that your skin barrier is your friend. It's meant there to protect you. Now we can alter the skin barrier to achieve these benefits. Like we said, it can have profound benefits in the deeper layers of the skin, but remember your barrier is important, so don't overdo it. Exfoliation is one of those things where it's not more is more type of situation. This is a situation where you want to be very thoughtful how often, when, and what type you want to be using on the skin, because your barrier is there for a reason, and you can alter that barrier for specific benefits of the skin, but you don't want to overdo it. Thank you all so much for tuning in. Please like, comment, and subscribe. Check out this product from L'Oreal Paris. It's a really good option if someone wants to get into these at-home chemical peels. check out the snake peel, and we'll see you all in the next video.
We'll see you next time.